as we speak. Well, to finish out the show, I want to get into the COVID-19 vaccine. Donald Trump sat down with an interview with Mark Levin this week, and he had something very interesting to say that I want to talk about. Take a look at this.
We have many companies doing it, great companies, Johnson & Johnson, Pfizer, Moderna. We have many companies doing it, and almost all of them are having these, so far, seemingly very good results. They're in phase 3 trial. That means we're right at the end of the process, really looking good, and could be really early. And so all of a sudden, instead of saying, wow, this is great news, we're going to have the vaccine early, they're saying, oh, the vaccine's coming out too soon, it's going to be unsafe, it's going to be all of these things. Has nothing to do with the safety. These are great companies. They're not going to put themselves on the line. They would have tremendous liability.
Obviously, President Trump has got that wrong. I hate the term fact checker, but I've got to be honest on this. When he says that they would have tremendous liability, obviously they're not. These manufacturers, Moderna and Pfizer and Johnson & Johnson aren't going to rush a vaccine out where they would have tremendous liability. You're right, Mr. President. You're right. They wouldn't if they had liability, which is why in the middle of warp speed, I would really appreciate it if you would put liability back on this industry. How can we trust any product by companies that have paid out hundreds of billions of dollars for murdering innocent people? How did they murder them? By lying about safety, whether it was Johnson & Johnson with talcum powder, or Johnson & Johnson and the Sackler family with OxyContin, or Merck and Vioxx, or, I could go on and on and on. But those were drugs, and we could sue, Mr. President. We cannot sue. They are not liable, and that is a serious problem. And if the 1986 wasn't bad enough, let me bring your attention, Mr. President, to the PrEP Act, which I hope you're aware of, but this is it. This supersedes the 86 Act. Public Readiness and Emergency Preparedness Act, the Public Readiness and Emergency Preparedness Act, PrEP Act, authorizes the Secretary of the Department of Health and Human Services to issue a declaration that provides immunity from liability for claims of loss caused arising out of, relating to, or resulting from administration or use of countermeasures to diseases, threats, and conditions determined by the Secretary to constitute a present or credible risk of a future public health emergency. Entitles individuals involved in the development, manufacture, testing, distribution, administration, and use of such countermeasures, meaning vaccines, folks. A PrEP Act declaration is specifically for the purpose of providing immunity from liability and is different from and not dependent on other emergency declarations. This is problematic. This is extremely problematic. And AstraZeneca was even bragging about this just a few weeks ago in many ways. Reported as having said, this is AstraZeneca, to be exempt from coronavirus vaccine liability claims in most countries. They went on to say, this is a unique situation where we as a company simply cannot take the risk if in 4 years the vaccine is showing side effects. Ruud Dauber, a member of Astra's senior executive team, told Reuters. What if in 4 years people start dropping like flies from immune enhancement that we thought we'd overcome? What if they have multiple sclerosis? What if they die like cancer, like they did from the polio vaccine when we accidentally had simian retrovirus contaminating everybody? We can't be held liable for that. And so, Mr. President, while they're not liable, I would really like you to not use that as one of the arguments on why we should be happy about warp speed. But let's talk about AstraZeneca. Last week, we reported that they did have an injury. It's not 4 years down the road. It's not 4 months down the road. It just happened days into their own trials. AstraZeneca suspends leading COVID-19 vaccine trials after a participant's illness. Of course, I'm talking about the transverse myelitis case that we just discovered and was reported last week.